Hi, I wanted to take a moment to talk about a device that we use frequently in our office called an expander. An expander is a custom fit orthodontic device that fits on the roof of your mouth, which we use so that we can make room for crowded teeth or correct a crossbite or help make room for some impacted teeth. So let's take a moment to talk about the different parts of the expander. This whole metal device is called the expander, and in the middle is this really critical part called the housing. In the middle of the housing is a screw, which is what you'll actually activate to make this expander wider. These arrows always point in the direction that you need to turn the screw in order to activate the appliance. The housing is held in place by these extension arms and these support bars and these bands which fit around the molars. All of those parts are held together by a solder joint. Let's talk about how to actually activate this device. So have your kid lay back on a couch or on the bed and make sure you have a good light to see in their mouth. Have them open them really big, kind of tip their head back and chin up in the air. And what you'll do is you'll use a little swivel key. We like to use one of these two types of lever keys. The way they work is you'll reach in from the front of the mouth and you'll look back here for a little hole between the two arrows where that screw fits. And when you have it in the right place, you can literally let go of that swivel key and it'll stay in place. If you don't have it in the right place and you let go, the whole thing falls, okay? So make sure that you get it in that hole or else everything you do won't work. Slowly push the lever back. I'm going to turn it at a little bit of an angle so you can see. You're going to slowly push the lever back. Takes a little bit of pressure. And that one turn activated this expander by 0.2 millimeters. So it takes 5 of those to even get a millimeter. So it's pretty nice and slow. Now you might feel a little bit of pressure against your teeth here on the sides. You may feel a little bit of tightness on the roof of your mouth because that's where the fault line is that runs in the middle of your maxillary bone. That's what we're actually expanding. So yeah, you might feel some tightness there, maybe even in your nose. You'll know that this is working when you see a gap develop between the front teeth. Don't worry, we'll close it up with the braces, but a gap is a good thing because that means that there's extra space that we've created with this device that we can use for resolving crooked and crowded teeth, impacted teeth to be able to come in. So the space is a really good thing. Don't worry, it'll be a temporary thing, it'll go away. And we should also go over how to clean the device. As you can see, there are lots of little nooks and crannies where food can get trapped. So it is a little bit of a challenge to get used to speaking and swallowing with this on the roof of your mouth. Give it some time. It takes about a week to adjust to it. You'll get there, I promise. Just make sure that you use a toothbrush, and you're welcome to brush this. You're not going to hurt it. Nice circular motions. Try to get those bristles to fit under the wire everywhere and in the little crevices between the teeth. You know, you can get these little pipe cleaners. I call them little Christmas trees. They're great for sticking between the wire and the gums and kind of getting in those areas that the toothbrush has a hard time cleaning. Yeah, so just keep it clean, and you know, if your gums are getting a little bit red or swollen, and maybe some saltwater rinses, that can kind of help with inflammation. It can help soothe the gum tissues. Really critical to keep this clean. Once this has been in your mouth for usually 2 to 4 weeks, and you're finished with all of the turns that you need to do, you got a nice big gap between your front teeth. Usually at that time, we're done turning. And you'll need to leave the appliance in your mouth for another 4 to 6 months. And the reason for that is because that fault line that runs down the middle of your upper jaw, it needs time to fill in with bone. You know, if we take this appliance out too quickly, then we'll lose all of the benefits of the expander, and everything will just collapse right back to where it came from. Now, when it's time to remove the appliance, we have some special instruments that lift the band off of the molars on both sides. Let's see if I can get this. This is going to be a little bit tight. I don't have that instrument with me right now, but the whole band comes off the molar just like that. And we'll take this off, We might offer to let you use that as your Christmas tree ornament for the year, or not, right? You can just throw it out. Kind of gross. We'll replace the expander with regular brackets here on these molars, and then we'll put a wire in everything. Here's a quick clinical demonstration on an actual patient. We put the swivel key into the hole and we turn the lever once, then carefully remove it. And that's it, folks. Thanks for watching.